Hello and welcome to Thrive eLearning. We're thrilled that you've decided to join us for the Thrive ePulmonary program. The ePulmonary program is an all-encompassing masterclass that will empower you with all the skills that you need to take control of your respiratory disease.
If you've been diagnosed with COPD, you've probably learned that breathing exercises are essential for symptom management as well as for slowing disease progression. Maintaining lung elasticity helps prevent, breathlessness and damage to other organs caused by oxygen deprivation. First, let's take a moment to review how the body gets oxygen. We all know that your lungs are your main respiratory organ, but your nose, your mouth, trachea, and larynx all participate in the breathing process, with most of the work being done by the diaphragm. You've likely heard a lot of respiratory muscles, a lot about respiratory muscles, but you may not know that the lungs themselves don't actually have any muscle mass of their own. They act as a bellows of sorts that are pumped using the diaphragm. As the diaphragm contracts or moves downward, it causes the lungs to expand, drawing in air, or inhaling. As the diaphragm expands, it pushes up against the lungs, forcing out air, or what we know as exhaling. The trachea leads to smaller tubes, bronchi, onto bronchioles, and then to a smaller but very important area known as the alveoli, which are the small sacs that are surrounded by capillaries. Well, the capillaries take oxygen via your arteries into the heart, which pumps the oxygen-rich blood throughout every cell in the body. As your body is using oxygen for various functions, a waste gas known as carbon dioxide is produced, commonly known as CO2. It is then transported back to the lungs to be forced out of the body or exhaled. When you are feeling short of breath or fatigued, it usually is not because you are not able to take enough air in. It's because your body is not fully exhaling, leaving your lungs full of carbon dioxide. As far as gases in the air go, the body is only able to use oxygen, but the air we breathe in today is only 21% oxygen. It is 78% nitrogen and 1% various other gases which must be exhaled along with CO2 in order to take in more oxygen. Often when patients begin experiencing shortness of breath, it makes them want to avoid activity altogether. When you do less, your muscles weaken, you get more breathless, and the cycle repeats and deteriorates from there. Instead, if you feel breathless, the first thing you need to do is to work to keep your anxiety in check. If you learn to do these breathing exercises effectively, knowing that they will soon alleviate your breathlessness, it will help with all that. Now, it's naturally panic-inducing to feel that you're not getting enough air. But when you become nervous or scared, your breathing becomes more shallow and moves up into your chest, making it more difficult for your lungs to clear out all the CO2. So if you start to feel out of breath, sit down, close your eyes just for a moment. Try to sit up straight so that your rib cage is nice and open, allowing your lungs to have some more breathing room. Take some nice deep breaths, exhaling as fully as you can. Now, as you may already know, the O in COPD stands for obstructive, meaning that your airways become inflamed and congested, making it, difficult to breathe. In this segment, we're going to teach you 3 breathing techniques which can be used for relaxation or to help with that breathlessness. Used on their own, they can be very effective. But when you learn to use them in a cycle, not only will they help with your endurance, they will help keep your airways nice and clear. This is known as what we call the active cycle breathing technique. In this course, you will meet several experts that we have invited to share, their knowledge with you. Michelle is a fitness trainer and also a certified yoga instructor. Today, she will show you the proper way to do pursed lip breathing, diaphragmatic breathing, and huff breathing or huff coughing. Then I'll be back to explain how they are all work together. But for now, here's Michelle.
Hi, today we're going to work on active breathing technique. This technique is to reduce chest congestion and to keep our airways clear. We're going to work on 3 breathing exercises. The first one is going to be pursed lip breathing, the second diaphragmatic breathing, and the third one is huff breathing. Let's work on pursed lip breathing. As with all breathing exercises, it's recommended that both of our feet are on the ground, all 4 corners into the ground, shoulders relaxed. Take a deep breath in, deep exhale out. Okay, so for pursed lip breathing, we're going to take deep breath in, hold it for 3 counts, and as we exhale out, hold it for 6 counts. Imagine yourself taking a deep breath in as if you're smelling a rose, and deep exhale out as you're blowing out a candle. So let's get started. Deep exhale in, deep exhale out. Let's do that again. Deep inhale in 3 counts, exhale out 6 counts. Let's work on diaphragmatic breathing. Diaphragmatic breathing is breathing through your diaphragm, also known as your abdominal wall. I want you to place your hands onto your abdominals, tips of your middle finger to touch, and press into your abdominals. As you take a deep inhale in, I want you to hold it for 3 counts. And as you inhale in, you will notice your belly expands, and as you exhale, your belly will contract. Let's try this. Let's work on huff breathing, also known as huff coughing. When breathing in, breathe in through your diaphragm, and as you exhale out, forcefully breathe out, making a ha or a huff sound. Let's try this. You'll find yourself, when you're exhaling out making that ha or huff sound, you'll feel a little bit of constriction in the back of your throat. Let's try this one more time.
Now that you've learned these techniques, you can use them for relaxation and to help catch your breath if you're experiencing shortness of breath. Used together, they will help clear your airways. The first phase, pursed lip breathing. Pursed lip breathing helps to relax your airways and open them as much as possible. The second phase is deep breathing or diaphragmatic breathing. This helps to fill your lungs with air. So basically what it does, it helps to fill your lungs with air, getting some wind behind congestion that might be present. The third phase, huff coughing or huff breathing, uses that air to force any congestion out that you may have. Now, your doctor or respiratory therapist can give you directions specific to your ability levels on how many cycles to do. However, we have put together a sheet that reminds you of the proper technique as well as suggests a routine to follow.
Be sure to download your active cycle breathing guide so that you can follow along as you become more proficient at this technique. This breathing cycle should be practiced regularly to keep your lungs clear and improve lung function in general. Follow the direction of your doctor or respiratory therapist, but generally, this exercise should be done at least twice a day. This technique can be particularly helpful to clear your lungs when you first wake up in the morning. You may also find it beneficial to do right before you eat to prevent breathlessness as your stomach gets full. If you take an inhaled medication, doing the cycle beforehand will open your airways more fully, ensuring that the medication can be inhaled deeper into your lungs. You've watched Michelle demonstrate each of the techniques for you. Go back and review if you need to. The Active Cycle Breathing Guide reviews the proper techniques for each exercise and gives you a sample cycle to try and discuss with your doctor.